This is the worst drug addiction epidemic in United States history. It's affecting millions of Americans. What we're dealing with nationally is an epidemic of opioid addiction. During the past drug addiction epidemics, the heroin epidemic of the 1970s and the crack cocaine epidemic of the 1980s, that hit low-income minority communities very hard, what we got from policymakers was the war on drugs, a crackdown on crime. We got mass incarceration. We got from policymakers a message that we could potentially arrest our way out of this problem. Now that the epidemic is hitting white America, we're seeing a very different response from policymakers. We're seeing a much more enlightened response. Even conservative Republican politicians, when you hear them talk about the opioid crisis, many of them start by saying, we can't arrest our way out of this problem. We need to see that people who are addicted receive effective treatment. You didn't hear that during the previous epidemics. It's good that we're hearing it now. It's too bad we didn't hear it then.
Just say no.
There are many people who've become opioid addicted taking pills as prescribed by doctors. And once people get addicted, they're not doing this because it's fun. They're not using heroin or prescription opioids because they're having a good time. Once you're addicted, you have to keep using to avoid feeling awful. The term addict is misleading. It suggests that there's this subset of our population that wants to get high off of drugs and they behave badly, and those are the ones that we have to really worry about, and everybody else we can prescribe all the opioids we want to. And there really is no such thing as an addict, and anybody can become opioid addicted. We have to prevent more people from developing opioid addiction, and more than anything, that boils down to much more cautious prescribing, so that we don't directly addict our patients, and so that we don't indirectly cause addiction by stocking everybody's home with a highly addictive drug. The other thing we have to do is, for the millions who are addicted, you have to see that they can access effective treatment. And you also have to see that that treatment is easier to access than heroin, pills, or fentanyl. But even if we stopped today creating new cases of addiction, so many people have this condition, we're going to be paying a price for that for many years to come.